I recently uploaded a video about how AI created content is spamming social media, YouTube, and almost every channel right now with information that's very simple, like simple life hacks, which in fact are misleading information or false information. And I have some more thoughts about this because we've been talking about how great AI is and how it can help in healthcare with diagnosis and therapy and all this stuff. But actually, yeah, there are two sides of the coin. And whether something's good, maybe there's also something that's bad with new technology. And what I see is that the AI gets its knowledge, or it's programmed in a way that everything that concerns urology and the middle of the body is a taboo theme. So whenever I upload a video or write a script and I upload it on AI and on ChatGPT and see whether there's some mistakes or if I could do something better, I very often get a message that all I do is against AI guidelines, meaning that AI maybe is not that good in knowledge when it comes to sexual medicine. I recently read an article, in urology, we have this European Board of Urology, and you can do an exam, which then gives you the fellowship. You become a fellow of the European Board of Urology. And every year as a resident, you can take an exam, which is called the in-service examination. And they tested the new ChatGPT model on the in-service examination, which is a very tough one. And it scored quite good, amazing, because the old model was quite bad at the in-service examination, but the new one was good. But I am not quite sure about sexual medicine, because when it's a taboo theme, the knowledge the AI has about these topics may not be that good. And it derives its knowledge from forums and from sources which are not evidence-based. And what I see on YouTube and other social media channels is that now we get lots of creators which create faceless AI-generated video with an AI voice, and they put some B-roll with some waterfalls and crowds of people and whatever it's suitable for the topic. And then they get scripts derived from AI. So AI is writing about a topic from sexual medicine and putting together a script. But this is not evidence-based, and it's misinformation, and it's even false. And how do I know? Because I work with ChatGPT every day. And when I research new topics, I found out that I get presented with all kinds of false information. So then I've started to question the results I get from AI. Just to double check, what you're saying is not right. You made that up. And very often I get some responses like, oh, I'm sorry, yes, that's not correct. So there's lots of incorrect information from AI. So when you have a channel with faceless video and you're not a doctor, you have no chance of double checking whether what AI puts together is true or not. You will promote misinformation on the internet because the videos that you put out there are not correct. And since there are many creators doing this approach and AI is the same, AI will come up with the same kinds of videos. And when you repeat this over and over again, thousandfold every day, and you have that many videos, false information in a way becomes true. It's like saying Earth is flat, and if you just do millions of copies and put it into video, eventually people will believe that Earth is flat. And if you just think about how we get socialized in our sexual development, everything pretty much nowadays is internet pornography. So we know that internet pornography, that's not reality. So this is kind of fantasy, and it doesn't represent real life. But then people get socialized with internet pornography, plus now they're getting this AI advice, which is false, and these simple life hacks. And eventually this will be a catastrophe in a way because people get misinformed. And I would say they get more sexual dysfunction because of that, because what they perceive to be reality, in fact, is not. And they tend to forget what sexuality is all about. So it's not just about intercourse and lust. Sexuality also has very much to do with, for example, partnership. And having a partner and communicating with a partner, this is one of the very core foundations of sexuality as well as procreation, right? So I think we have to counteract this. We are the professionals. We are the ones who sit with all the knowledge. And I am one urologist who tries to counteract this. And this is not only true for sexual medicine, it is also true for example, prostate issues. So when we talk about benign prostatic enlargement, there's so many videos on the internet telling people that benign prostatic enlargement, in fact, is a kind of swelling, which is so dumb, you can't believe it. So they tell people that if you drink this or that, or if you eat this or that, then the swelling will go away, which is far from the truth. And I've started a campaign, it's a hashtag #bpeisnotasewelling. And the other hashtag is ... is not making the prostate shrink. So if you want to join this campaign, feel free to do so. I'm putting the hashtags in the description so that you can also post videos, because I think we have to speak up. We have to speak up as the urological community and the ones who are in charge of sexual medicine, because we owe it our patients that they get information which is true, or at least it's evidence-based, and not some simple life hacks like eat a banana with cinnamon at each night and your erections will be superior, which it's a very bold statement to say so, as I may say so. So join this campaign, post videos about conditions so that we can educate the world how we see it, because from experience, I know that people who watch videos, they have a totally different approach than healthcare providers. And they think that things are important other than we think that are important. So that's maybe some of the issues that we have communicating with our patients, that we just don't listen because we don't think it's important. And patients tell us things that they think is important, which we say, well, that's nothing. So go away. We don't want you in our offices. Thanks for listening. Thanks for watching. And I will keep posting. Bye-bye.